Some of the work published by CARE's own Dr. Palaniappan, Leta's work in California showed that South Asians are having 4 times the rate of cardiac events, and these events are happening 11 years earlier in life. So what's going on, and how do we stem this bleeding, essentially, of major events happening at a much higher rate in a young South Asian population? Well, let's look at some little more data to prove that this is happening. Well, that traditional risk score that you saw, we know that the rates of heart disease are much higher in South Asians, but compared to other populations. But what are the risk scores showing? Well, as we just saw, the risk scores are almost identical when you calculate them. So the risk scores are terrible, basically, is what this is saying, in predicting events in South Asians. So we really do need much better models that are including maybe new types of risk factors. Now, what are these risk factors that I'm talking about? What's the non-traditional risk that I'm speaking to? What we see here are 3 big buckets. And the first one you may have heard of before, which is insulin resistance and prediabetes. The second bucket of risk is something called inflammation. And these are 2 examples right here on the screen. Lp(a) or lipoprotein A, and apolipoprotein B100 or ApoB. So these are the kind of 2 culprits that are rarely tested for in the general population, but every patient in SSATHI gets this tested at least once. Lp(a) is genetically mediated. ApoB, there is some genetic linkage to how much you have in relation to LDL, but it largely tracks with your bad cholesterol levels up and down. Now the good news is that we can actually treat this. If we lower LDL in a patient, we can lower ApoB. But with Lp(a), it's genetic, and if we try to lower LDL, we will still have high levels of Lp(a). But right now, we're testing new treatments that can specifically lower Lp(a) that will read out probably next year sometime. And so there is a lot of hope on the horizon for the South Asian population. We started the Stanford South Asian Translational Heart Initiative in 2014 to do personalized risk reduction. So what is SSATHI? SSATHI is a targeted heart risk assessment program to move the needle on this epidemic. We start by checking these non-traditional risk factors. So we use these non-traditional risk factors along with the traditional stuff, high blood pressure, diabetes, smoking, obesity, that you've all heard of, to actually craft an actionable plan. We do an adjusted risk score for patients that we think captures the rest of that curve that you saw, that difference in predicted versus actual event rates. We actually create our own risk score that trues that up to what we think is actually going to happen to our patients. So is it working? And the answer is yes, it is working. And we see over 90% of our patients reclassified to a lower risk level in 6 months, which is really something we're very proud of, very impressive. So I really want to emphasize, like, as you're looking at this information, like, what should you do? If you haven't been screened for your South Asian specific risk factors, you need to do that. And not just you, but your wife and your husband and potentially your children, depending on their ages and stages of life. If you have a family history, which many of you do, of heart disease or stroke, this is even more important. So getting your family screened, getting yourself screened is the first step.